Hey Matt, how's it going?
That's good, yeah. We've got a 50-year-old coming in for emergency laparotomy. It's not that great, he's got a really bad chest infection, but yeah, we'll get him through it.
Okay, sounds all right. Listen, I'm going to loiter in the background. For any problems, just give me a shout, all right?
Perfect, much appreciated, thank you.
Okay, no worries.
There's a grade 1 beef actually, which is pretty good because he didn't pre-operate it very well. I'll just tie this in and I think we've called the surgeons.
Hey Matt, he's desaturating.
No amount of bagging seems to be fixing this.
Are you all right, Matt?
He just keeps on desaturating.
Oh, okay. Any chance that the tube could be in too far, Matt? Don't know about you, but when I do RSIs, I have this terrible habit of stuffing the tube down a bit too far.
I'll have a little look, Alice. Could you take over with this?
Yeah.
Thank you. So we've got coarse breath sounds both sides, with crackles. The tube's only in at 23, but I must have pushed it in a little bit when I did when I tied it in.
Okay, well I'll tell you what. Let's have a look with some ultrasound and see what it's like.
So this is the right side.
Okay, so it looks like there's nice normal lung sliding there.
And this is the left.
On this side, however, you can see that that speckly white line doesn't move backwards and forwards, so there is no pleural sliding on this side. And just to say, if you find that there is no pleural sliding on either side on ultrasound, despite adequate ventilation as far as you're concerned, then you should very much consider an esophageal intubation.
Maybe pull the tube back a little, Matt?
Yeah, I must have pushed it in a bit when I was tying it in. He hasn't got much reserve, has he?
How's it going, Matt?
He just keeps desaturating. It's not good if I'm honest.
I have to say, it's a bit of a shame that we couldn't have treated the chest infection before we came to surgery, but that's emergencies for you.
Yep.
Sounds like he's desaturating again.
Yeah, and again, yeah.
Oh, I think there's every possibility you could have potentially mobilised a bit of sputum.
How would I know?
Ah, well, what's my answer for everything, Matt?
Okay, the ultrasound. So the left looks normal. I can see the pleura sliding. But the right just doesn't look right. I don't think it's really moving at all. Can you make it look any better?
Sure. Try each side now with M mode on the ultrasound on.
So this is the left.
So that's the seashore sign. Rippling waves onto a sandy beach. Nice and normal.
And this is the other side. It's not quite the same.
No, it isn't. No pleural movement, so no seashore sign. But do you see those vertical lines on there?
Yes.
Well, imagine if they were in time to the heartbeat.
Okay.
Well, that's called lung pulse. They call those lines T-lines. The only reason there is any movement is because the transmitted cardiac pulsation causing the pleura to move in time with the heartbeat. It tells you the visceral and parietal pleura are touching, so no pneumothorax, but no sliding, so no ventilation peripherally. That's atelectasis, absent distal expansion. In this case, I reckon it's a sputum plug.
So suctioning, nebulizers and gentle agitated bagging it is then?
Absolutely. Anaesthetist becomes physiotherapist. Hey Matt, how's it going? Are they nearly done?
Not quite, but I nearly am. I really am beginning to wonder if we should have gotten him some physio before the surgery.
Oh, okay. Chest infections. I'm sure we wouldn't have known it was going to be this bad before we started, but there we are.
Well, he's been getting worse over the last few minutes.
Oh, really? How do you mean?
Continuing to desaturate, airway pressures are climbing, and the physio that I've done earlier on just doesn't seem to be working now.
Oh, okay. Well, we could have a quick look with ultrasound, see if anything's changed.
So the left looks normal. You can see the pleura sliding. And there's the seesaw sign. But on this side, there's no sliding. There's none at all. And the pleura looks super white with bright A lines.
Okay, Matt, so what about M mode then?
No sandy beach here, horizontal lines all the way.
Like a barcode?
Yes, exactly, yeah.
Welcome to the barcode sign then. Or the stratosphere sign. Like layers of the atmosphere. Highly suggestive of a pneumothorax, I'm afraid.
Well, that's no fun.
For definitive diagnosis, we'd find a lung point. An area with pleural movement on one part of the view, but not on the other.
Like this.
Yes, like that. I'll get the chest drain set to decompress it. Do you want to tell our surgical friends, or shall I?